Top 5 therapies employed for treating addiction and substance abuse. How can talking about your problems help heal substance abuse? Isn't it all chemical? Well, yes and no. Addictive drugs over time cause actual physical changes in the brain, and this alters the way people behave, which is part of what drives addiction. But there's other things that drive addiction too. Past experiences, mental disorders, and more all play a part in addiction. And this is where therapy comes in. Talk therapy, group therapy, and more all play massive roles in helping people stop using drugs, and here's how they work. Number 1, cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is a form of talk therapy that's been proven to be effective for treating a wide range of problems, including addiction and mental disorders. CBT operates on several principles. First, psychological issues are based on distorted ways of thinking. Secondly, these issues are also based on learned unhelpful behaviors. Thirdly, people can learn better ways of thinking about and coping with their problems. CBT helps people develop healthy ways of thinking, acting, and coping. Number 2, dialectical behavioral therapy. If DBT, dialectical behavioral therapy, sounds similar to CBT, it's because DBT is based on it. DBT is a form of talk therapy made for people who experience extremely intense emotions. The word dialectical describes combining two opposite ideas. It helps people accept the reality around them while helping them to change their lives and avoid harmful behaviors. Number 3, motivational interviewing. One of the biggest challenges in treating addiction is helping people find motivation to engage in recovery. Motivational interviewing isn't like going to boot camp or anything. Instead, therapists listen to their patients to make sure they understand their patient's goals, struggles, and feelings. The therapist then helps the patient understand that they are able to change, helping them discover their inner strengths and skills. Motivational interviewing also helps patients resolve their own struggles and find ways of thinking about how to achieve their goals. Number 4, eye movement desensitization and reprocessing, or EMDR. One of the biggest drivers of substance abuse and addiction is trauma. Surviving trauma often leaves people with symptoms like flashbacks and intrusive thoughts, which can be so bad, it drives people to self-medicate with drugs and alcohol. EMDR therapy helps people process the traumatic experiences and treat mental disorders like PTSD and acute stress disorder. EMDR works by having people move their eyes as they process their traumatic memories. A therapist guides the patient's eyes by moving their hand, a light, or something else that the patient can focus on from left to right. And as the patient does this, they review their traumatic memories. This combination helps them reprocess their trauma. Number 5, individual, group, and family therapy. The biggest lie of addiction is that it tells people they're alone, and they're not. During drug rehab, patients participate in one-on-one therapy, group therapy, and family counseling. Group therapy helps people realize that they're not alone, that others have similar stories, problems, and goals. Family counseling helps people repair and strengthen relationships with their family members. Finally, individual therapy allows a person to really work on the issues behind their addiction, using many of the therapies we talked about earlier. All of these therapies are useful at The Edge. I'm Jeremy Arts, and when I helped build the programs here at The Edge, I wanted to make sure that they were safe, they were helpful, and effective. All of these treatment modalities play major roles at our treatment center, and I've seen them work. Give The Edge Treatment Center a call at 844-590-0403, and we'll tell you everything you want to know about our programs. Hey, if you've had an experience with these therapies, how did it go for you? Share your experiences and thoughts in the comments below. It's interesting to hear about how these therapies worked for others. Thanks for watching our video. Hit those like and subscribe buttons. We're always updating our channel with the latest recovery and mental health content. See you next time.